ثالث مش ماخذين. السلام عليكم.
وعليكم السلام ورحمة الله دكتور.
ايش ماخذين لحد الآن؟
دكتور أول شيء أخذنا دكتور عدنان سيمتومولوجي يعني على السيمتومز، كل سيستم أخذ بيه السيمتوم مالته. بعدين نعم، وبعدين اجانا دكتور حيدر اخذنا الانفكشيوس ديزيز بس بارت واحد.
ممتاز. ودكتور فائز اخذته جي اي تي؟
اخذنا جي اي تي بس بيوم على اساس الدكتور عدنان يجي بس اخذنا دكتور فائز، يعني المفروض المحاضرات كانت الدكتور فائز.
احنا راح ناخذ سيمتوماتولوجي من هيماتولوجيكال سيستم.
تمام دكتور.
صوت واضح؟
كلش واضح دكتور.
And to start with, the hematological system is based on the blood. Blood have three components: HB, white BC, platelet. The symptomatology of this system is depend upon these three parameters. Abnormality related to HB when the hemoglobin level is decreasing, it's called anemia. When the HB is increasing, the disease is named or called polycythemia. The symptoms of anemia is sharing with many systems. Anemia may be presented as palpitation. What is palpitation? Palpitation is awareness of heartbeat. So patient may be presented to cardiologist because of palpitation. And the disease underlying this symptom is not cardiological disease, is hematological disease, anemia. So there is sharing between symptoms caused by anemia and other systems with the same presentation, palpitation. Again, palpitation may be presented to endocrinologists because of thyrotoxicosis. So palpitation may be presented to cardiologists because of primary cardiac disease, may be presented to hematologists because of anemia, may be presented to endocrinologists because of thyrotoxicosis. This is when the level of hemoglobin is decreased. The patients get palpitation. The other symptoms of anemia is fatigability. What we call it exercise intolerance. When the patient has exercise intolerance or fatigue, this is a sole sign of anemia. Again, fatigability is a sign of cardiac disease, not specific for hematological disease. May present it to cardiologists because maybe cardiac disease, heart failure. In hematology, the fatigue, exercise intolerance may be due to anemia. Again, may be presented to endocrinologists, and the cause may be due to hypothyroidism, fatigue, exercise intolerance. One symptom of anemia, the first symptom was palpitation. The second symptom, fatigability or exercise intolerance. The third symptom of anemia, lightheadedness or dizziness. This is because of poor oxygenation to the brain and poor circulation because of failure of RBC carrying enough oxygen. There is a lightheadedness or dizziness. This symptomatology related to hematological system when the RBC is a cause by reduction of RBC count causing anemia, low HB. And on the contrary, when the RBC is increasing and the HB become higher than normal, so there is a symptom of what we call it polycythemia. Poly indicates something high in amount. Cythemia indicates high RBC in circulation. Normally, there is a normal RBC count. When the RBC count increasing in amount, when it moves inside circulation, this will result in stasis, slow circulation. And this again result in brain dysfunction, in muscle dysfunction, in GIT dysfunction, cardiac respiratory dysfunction, because of high, large amount of RBC inside the blood vessel result in stasis, slowness of circulation, vasocirculatory disturbances. So the patients may feel headache, pain, headache. And this headache may be explained by high RBC count. Again, dizziness, lightheadedness, forgetfulness. He cannot remember, he cannot recall an event. Slow mentation, when he thinking, when he want to think and he want to analyze any problem, there will be slowness in thinking. These are symptoms of polycythemia. A special burning sensation in hand and feet, burning sensation. When the RBC count increase in circulation, there is a sensation of warmthness, burning. This is called erythromelalgia, a painful burning sensation of upper and lower extremities. These symptoms are due to high RBC count, or what we call it polycythemia, and the contrary to anemia. This is the symptoms related to the first parameter in blood, HP. RBC, HP, low HP, anemia, high HP, polycythemia. What about the other parameter in blood, the white BC? What does dysfunction, what does abnormality related to white BC result in? We should know the function of white BC, the physiology of white BC. Definitely, white BC have a multiple function. One of the major rules of white BC is defense mechanism, which is responsible by neutrophil, absolute neutrophil count. The neutrophil is the blood cell fighter against infection. The sign of the first sign of infection is fever, high temperature. So one of the major symptomatology in hematology is fever. Fever is a sign of infection. And this may give a clue for underlying white BC abnormality. Normally, the white BC count is increased as a reflex to infection. When there is infection, normally there is high white BC count. This is the normal response. This is the physiological response. But when the disease itself attacking the white BC, causing a low white BC count, what we call it leukopenia. Leuko, white BC, penia, low. low white BC count is called leukopenia. Maybe the cause of fever itself, infection, and the infection is caused by low neutrophil, no immunity, no defense mechanism. So the bacteria will attacking the body, and this results in infection, fever occur in setting of neutropenia, neutrophil penia, low count, neutropenia, it is a low neutrophil. So we have a special important term called neutropenic fever. It is neutropenia, low neutrophil. We say that there is a leukopenia, low total white BC. White BC, we have a neutrophil, have a lymphocyte, have a basophil, have eosinophil. When a specific subtype of white BC is get diseased in neutropenia, and as we know that the neutrophil is the best body fighter against infection, so when there is a neutropenia, there is a risk of infection. Infection may present it as fever. So what we have? We have a neutropenic fever, one of the top emergency in hematology. What we call it neutropenic fever, top hematological emergency. Why it is emergency? Why we behave with fever in setting of neutropenia as emergency, and we didn't behave like this with other infections? When we have infection, we have fever, it is infection, it is fever, it is a disease. But usually we have no urgency to treat, no emergencies to treat. But when we have a fever plus neutropenia, we have a top emergency, because the neutropenic fever is a life-threatening event. Life-threatening event. The patient will die if you didn't treat him urgently. You are facing a top emergency. It is a neutropenic fever. Why? Why neutropenic fever is an emergency condition, and we should check any patient with fever about the neutrophil count, about the white BC count. Simply, fever indicates infection, and the infection, as I mentioned earlier in this lecture, that normally when there is infection, there is a high white BC count which fight the infection. So if you have already no neutrophil, if your body is empty from white BC, from where you can get a fighter? So the bacteria will proliferate, and the result will be death, because there is nothing against bacteria, nothing to prevent bacterial proliferation, nothing to prevent bacterial separating, nothing kill bacteria. You have no neutrophil to killing the bacteria. So in this condition, usually we label the patient as immune compromised patient. We have immune competent patient, normal patient, normal person, normal white BC, normal defense mechanism, and he get a fever. We call it fever and immune competent. His immunity is okay, competent immunity. But when you have fever and setting of neutropenia, so we labeled this patient as immune compromised patient. His immunity is already compromised. And because the body and the life depend upon the immunity, when he has no immunity, we can get death if the infection is not treated urgently and the antibiotic is not prescribed emergently. So we have immune competent, immune compromised patient. Neutropenic fever is a top emergency in immune compromised patients. Fever is a main symptom in hematology, and you should secure the white BC count. When your white BC count is high, you are happy because your defense mechanism is okay. And you have a soldiers, you have a killer against infection, against bacteria. But when you check the white BC and your white BC is low, and the neutrophil is 0, you have no soldiers, you have no killer against bacteria. The bacteria will kill you. The bacteria will kill your patients. The bacteria will end the life of your patients. Fever. What about the third parameter in blood? We are already talking about HB, high and low. We are already talking about the white BC, high and low. And now we're talking about a third parameter in the blood, platelet. What is platelet? Platelet, it's a fragment, a small fragment from a large cell inside the marrow called megakaryocyte. There is a big cell inside the marrow called mega. It is large, it is mega. Karyocyte. Megakaryocyte, there is a fragmentation from it called platelet. The platelet is a small pieces responsible for hemostasis, prevent bleeding, cause thrombosis. Bleeding under thrombosis is called hemostasis. Platelet will aggregate when there's blood vessels injury. It will aggregate at the site of injury and result in plaque, stopping bleeding by a plaque. Abnormality related to platelet when the platelet count is low. It's called thrombocytopenia. The platelet cells is called thrombocyte. When there is a low platelet count, we call it thrombocytopenia. Penia, low. Thrombocyte, low. Thrombocytopenia. When there is a thrombocytopenia, there is a low count of platelet. The patient will have a higher risk of bleeding. He will bleed because he have no enough fragments of cell that close the crack inside the injured vessels. Thrombocytopenia may be presented as bleeding. From where those bleeding can be observed? From nose. Bleeding from nose. We call it epistaxis. What is epistaxis? Epistaxis is bleeding from nose. Nosebleed. Maybe bleeding from gum. Bleeding gum. The mouth and oral cavity, teeth are oozing of blood, gum bleeding, or bleeding from stomach, from GI system, blood from GI system. Bleeding from GI system in two types. Either you get a fresh blood with vomiting, blood, bloody vomitus, we call it hematemesis, or there's a small amount of blood inside the stomach, get it digested, and the patient vomit not a fresh blood, he vomit a material look like coffee in color, milk and coffee in color. We call it coffee ground vomitus. This indicates in small digested blood altered by acid inside the stomach. We call it coffee ground vomitus. Or there's bleeding from lung by coughing blood. Coughing blood, hemoptysis, epistaxis, gum bleeding, hematemesis, cough ground vomitus, hemoptysis. Or again, the blood appear in the stool, either fresh blood in the stool, hematochezia, or altered blood by acid again and called maline. Maline. Maline is an offensive, tarry, sticky stool due to upper GI bleeding. What is maline? Maline is a sticky, offensive, tarry stool, usually due to upper GI bleeding. Fresh bleeding, per rectum, hematochezia. Altered blood in the stool, black, tarry, black in color, tarry, offensive stool, sticky, unwashable, maline. When the bleeding is occur in the urinary system, when he pass a blood in urine, we call it hematuria, hematuria. Hematuria or hematuria is a bleeding in the urine, hematuria. Or there is excessive bleeding in the menstrual cycle, heavy menstrual bleeding. Previously, the obstetrician, the gynecologist, name it as menorrhagia, heavy menstrual period. Sometimes the bleeding occurs under the skin in very small amount. A small bleeding in the skin in the size of pinpoint, a pinpoint bleeding less than 1 millimeter in size, we call it petechiae. Petechiae is a pinpoint cutaneous bleeding. And this is a clue for thrombocytopenia, a low platelet count. When the bleeding in the skin gets larger in size, more than 2 millimeter in size, it is not petechiae, it is purpura. So purpura is a bleeding, is a cutaneous bleeding due to thrombocytopenia, and usually larger than petechiae. When there's a big, large bleeding in the skin, larger than purpura, what we call it? We call it echemosis. What is echemosis? Echemosis is a big, large area of cutaneous bleeding that could be a sign of thrombocytopenia. Sometimes the bleeding is overt, can't be seen by eye. And sometimes the bleeding is covered, cannot be seen by eye. Occult bleeding. Example of bleeding that you need to search about it, bleeding inside the eye, retinal bleeding. Maybe thrombocytopenia cause a bleeding inside the eye, cause retinal bleeding. So the symptoms of low platelet count, thrombocytopenia is a bleeding. Bleeding from where? From epistaxis, from gum bleeding, hematemesis, hemoptysis, cough ground vomitus, maline, hematuria, heavy menstrual bleeding, petechiae, purpura, echemosis. By these three element disturbances, we usually cover the symptomatology in hematology, abnormality of HB anemia, polycythemia, abnormality in high and low count like BC fever, abnormality of low platelet count thrombocytopenia. We have symptoms related to high platelet count thrombocytosis. When the platelet count getting higher up, we call it thrombocytosis. And simply, thrombocytosis cause thrombosis. And the thrombosis result in occlusion and ischemia of organs supplied by the vessels. Example, weakness of the arm, of the leg, of the facial muscles when there is stroke, when there is ischemia in the brain, lower leg pain due to ischemia to lower leg. Thrombocytosis may result in a thrombosis, and the thrombosis resulting in ischemia, and whatever the site of the ischemia, the result, the symptom related to this system. By this, I think we cover all symptomatology related in hematology from the HB white BC platelet. Please, any question? اللي يريد يسأل سؤال يفتح السبيكر الفون ويحكي. طلاب صف ثالث، أي سؤال، أي استفسار، أي شيء ما واضح. تسمعوني؟
نعم دكتور، الصوت كلش واضح. شكرا جزيلا دكتور، سلامتكم.
ماكو أي استفسار، أي سؤال؟ المحاضرة واضحة؟
سلامتكم دكتور، شكرا جزيلا، كلش واضح.
أي سؤال، أي استفسار، أنا موجود بالفرع، وإن شاء الله ما تحتاجون أي شيء. إن شاء الله بي سيف، سلامتكم.